Hey everyone, this is Nikki, the CEO of Transform Nursing, and thank you so much for joining me live. I really appreciate you guys today. It's been a little while since I've joined. Don't mind my printer in the background. But I just wanted to come on today. Happy New Year to everyone, and just to share a little bit about some of my thoughts, my vision. I, as you know, focus on real nurses who have real conversations and who have real results. And really, even more so, hey Kima, good to see you on. Even more so, I really feel like I focus on people who are leaders who want to have a social impact on the communities that they serve. And social impact really is all about understanding your own behaviors, beliefs, and values and what that does to the community that you serve or that you work with. And as a nurse, I really believe, hey Yolanda, great to see you on. Happy New Year. As a nurse, I really do believe that we are the change agents for our patients, especially when it comes to higher level wellness and health equity, which means that our patients have similar experiences when it comes to their healthcare outcomes, right? Further, we can even impact our patients' community through our work as influential leaders. And I believe it is my mission to help nurses and other healthcare professionals to influence their peers to be more mindful of health equity and social justice. That is the work that we get to do. That's how we get to contribute to healthcare. And I do a lot of my own work through teaching, workshops, and courses. I have a course called the Nurses Influential Leadership Lab. It's on my website at transformnursing.com. Definitely check it out. I love to do community engagement projects. So I did a recent workshop last year called Racial Justice Unpacked. It was phenomenal. I had great feedback from participants all over. Hey Jackie, good to see you on this morning. And I really like to see the ripple effect that the work that I do and that we do as professionals, as peers, has on people's lives. And it does have an effect, not only on your personal, but your professional life as well. So keep that in mind as you're thinking about what we're talking about today. So what we're going to talk about today is what is the value of community-based organizations to healthcare systems? Again, what is the value of community-based organizations to healthcare systems? And for those that don't know what a community-based organization is, here's a very general definition. It's an organization that is representative of a community and works to meet community needs. And conversely, a health system is an organization of people, institutions, and resources that deliver those health services. So those would be obviously our hospitals, our emergency departments, urgent care, primary care. Those are health systems. And community-based organizations are what I'm really going to focus on today. But before we really begin, we do have to take a moment and honor Dr. Martin Luther King Jr. Day with one of my favorite quotes of his. And here's a quote that I want you to think about. His quote says, "Our lives begin to end the day we become silent about things that matter." I'll say that again. Our lives begin to end the day that we become silent about things that matter. So deep. I appreciate him so much for the work that he's done and for just giving us such clarity, especially around healthcare. And we can talk about that even more later. But before we really dive in, feel free to tell me where you're listening from or what you do. I have all kinds of people that come on here, so feel free to share with me. So where this story is really coming from is that very recently we've had some changes in the organization that I work for, which is a community-based organization. And I want to ask you a question, like how many of you have worked for such a great leader, such a great boss that it just really hurt to watch them go? I have not had many of those experiences, but I've recently had one of those, I have to say. I am 39 proudly, and I have yet to work, well, I'll say this is the first time that I've worked in an organization that really puts the needs of clients and patients first. And I've worked in a lot of them, right? I've worked in very big health systems. I've worked in smaller sort of systems, but this is the first one where inclusive leadership seems to be across the board what we do, where we collaborate with other people. And I think it's a real value of community-based organizations. So I want to highlight that right now. So in this CBO that I work for, which is the JOCS Initiative, like I said, we had a leader who left our organization, and she caused me to really think deeply about who we are as a community-based organization, about the services that we provide, and the value that we add to the health system that we serve. And our mission, it called me to think about our mission and our vision, and it even called into question some of the things that we believe in terms of our mission and vision and values as the JOCS Initiative. And I wanted to share about it because JOCS Initiative is very unique. We are affiliated with the University of Maryland, and many community-based organizations are not really affiliated with such a large health system, whereas we are sort of nested inside of this system. So I want to share their mission with you. The JOCS Initiative mission is to change lives, engage communities, and support health systems affected by HIV and hepatitis C. And what makes them unique, like I said, is that they actually are a part of the University of Maryland, which is a huge conglomerate in the state of Maryland, right? We provide all kinds of services. And we work with these partners to help hard-to-reach clients in the community. And I wanted to take a moment and highlight why health systems need JOCS Initiative, why they need community-based organizations so much. Because without them, that connection that we have with the community would be lost. According to AIDSview, the number of people living in Baltimore City with HIV in 2016 by race was 76%